Hello, my name is Marshall George, and I'm currently a second-year pharmacy student at the University of Texas at Austin College of Pharmacy. I'm also a student director for the Texas Pharmacy Association's Student Executive Board. I'd like to take the next few minutes to talk to you about some of the issues I see currently facing pharmacists, future pharmacists, and the practice of pharmacy as a whole. Namely, I'm going to address the importance of pharmacists gaining provider status, the major healthcare reform of our nation's healthcare system as relating to provider status, and finally, the importance of lobbying for our profession. It is my hope that by the end of this video, you've come to better understand the important role pharmacists play with respect to patient care, the role we play in our changing healthcare system, and the paramount importance of advocating for our profession in an intelligent and unified manner. Firstly, let's look at the topic of provider status. As many of you are probably aware, pharmacists in California recently won a huge victory in the fight for provider status. Pharmacists of the Golden State are now recognized healthcare providers under California state law. While this is not the norm, it needs to be. The vast majority of pharmacists are capable of providing a wide variety of cognitive services, like providing a wider range of vaccination services or ordering and interpreting lab results than they're currently allowed to or reimbursed for. Allowing pharmacists to practice in a manner that is consistent with the breadth and depth of their training would not only ease the burden that limited access to primary providers places on patients, but it would ease the burden of our understaffed primary care workforce as well. Now let's talk about healthcare reform. This is a big topic of discussion right now as the U.S. healthcare system is undergoing its biggest change since Medicare Part-D implementation in 2006, and probably the biggest change since long before that. With the advent of the Affordable Care Act, also known as the ACA or Obamacare, our entire healthcare system has begun a major shift that will change the way patient care is delivered and paid for. Our system is moving away from the traditional fee-for-service model, and it's moving toward an outcomes-based model built upon the idea that a team-based care environment will promote the best use of resources and provide the best patient outcomes. What does this mean for pharmacists? It means that we've finally been presented the opportunity to prove what we've been telling the healthcare community all along, which is that our knowledge as the medication experts is invaluable to the healthcare team, and that we need to be recognized for that knowledge and expertise by being granted provider status. Lastly, let's look at the topic of advocating and lobbying for our profession. While there are a plethora of pharmacy organizations at both the national and state levels promoting the needs and wants of pharmacists across the United States, we are still overall a divided force. By nature, the attitude of the typical pharmacist is more passive versus assertive, which is fine in some respects, but not when it comes to making sure that the profession as a whole has a voice in deciding what's best for it. Largely, pharmacists in the profession of pharmacy currently are just not participating. Without a united front, we cannot expect to effectively lobby for rights that we are owed as pharmacy professionals and experts. More simply stated, without a determined, powerful, and single voice, we will not likely see pharmacists earn provider status across the United States or be able to practice to the fullest extent of our abilities as members of interdisciplinary healthcare teams in the near future. This will ultimately translate into poor patient outcomes because, as we all know, and as I said before, we are the medication experts. In summary, the ability of pharmacists to unite and gain recognition for our abilities and the work that we do is paramount. This is where you come into the picture. Whether you're a practicing pharmacist, a student pharmacist like myself, or another healthcare professional who understands the value of the services that pharmacists provide patients everywhere, you need to speak up for the profession. You can do this many ways, but the best way is to join your state and national pharmacy organizations. While you might think that joining an organization isn't worthwhile, because maybe you can't attend the annual conferences or the mid-year meetings, this simply isn't true. Simply by paying your dues to the organization, you've helped promote the profession by helping to fund those who do have the time to actively advocate and lobby for you in your stead. Engaging in the policy process is critical for our profession, and I challenge you to make a commitment to take part in the policy process. Either make it a goal to personally advocate, or make it a goal to become a part of an organization that advocates for you for the betterment of our profession. With that, I'd like to thank you so much for taking the time to watch this video, and I encourage you to stay tuned for more updates from the Texas Pharmacy Association.